what does chronic pain do to a person? So not only does it affect them on a day-to-day basis, it affects the simplest of activities, the quality of their life, sleeping, even the thought of picking up a dog bowl can seem like an effort. So the things that we often take for granted, the people that suffer in pain tend to even have to think hard before they would even do something so simple. So that's one of the first things. It's the frustration of the fact that even the daily activities they can't do. The other one is the fact that the mere thought of going out to dinner, the mere thought of going to walk their dog, they can't even do that. So the simplest things that people, normally before their chronic pain, they didn't have to think twice before they do it. And now it's a struggle to do that. So it can be very, very isolating and very, very frustrating. The other thing is that it impacts their relationships with their spouses, with their friends, and with their family, or their spouses and their kids, right? So, for example, if the grandkids come to visit in spring break and they plan on going to Disney, for example, instead of grandpa or grandma being included in the plan, they are not invited because they slow them down. Or, what's the reason for coming to Florida? It's so that we can enjoy the sun, we can enjoy walking on the beach, and that can be almost like an impossible task when you are in a lot of pain. With the weather being great, people who love golf or tennis, those are things that they would have loved. That's the reason also for moving to Florida, and then they find themselves not able to do it, or sometimes they force themselves to do it, but they dread it because they have to pay for it the next day. And so there's this emotional toll of feeling isolated, feeling frustrated, and the fear of the consequence when they do decide to do something. So I totally get that. I hear that a lot from our patients. And so I thought that if we can share some tips to make life a little easier and even give them hope, that is the purpose of today's call. One of the questions that is often brought up to us is, will chronic pain ever go away? Imagine thinking that this is it, that life is going to be a struggle every day, or that they are going to lose independence a lot sooner than they expected because of it. So how do you deal with chronic pain? I'm going to give you some tips that can make life a little bit easier. The very first one, and we're a big proponent to this, is do gentle stretches. It does so much to you. It may be a bit scary in the beginning, because when you think of stretching, you think, oh my gosh, I'm going to pay for it the next day. So I'm going to explain to you why stretching is so important. There are over 600 muscles in the body, and there are only 206 bones. You've heard me say that time and time again. The reason why stretching is so important is this. When you are in pain, you modify your behavior, and because of those compensations, you tighten certain muscles. And so why does a tight muscle cause pain? So I don't know if you're aware of it, that muscles are typically attached on both ends, but the middle part is floating. That is the reason why we can move, because the middle part is floating. Okay, it's free. So for example, if this is your muscle, okay, this is one attachment, and the one in the scalp, that's the other attachment, and this part in the middle is floating. Now, let's say that is tight. When it's tight, it's going to tug at the attachment. So what happens when you tug at the attachment? It is going to hurt. So you assume, or a lot of people will assume, it's a joint problem, but it's actually the muscles that are tugging it. So why is it that the pain tends to be in the joint? Because most of the muscles are attached near the joint. And so that is the reason why I encourage people to do gentle stretches. Because if it's actually tugging, but you try to gently stretch that, eventually that is going to relax and then it will stop tugging. Proper sleeping position. I find it very interesting that not a lot of people know how to sleep properly. But if you're a side sleeper, you put a pillow between your legs. The reason why we encourage that is really just to keep your leg in a aligned or neutral position. Nothing else behind it, other than you want the leg to be in line with the body. Because when it doesn't, and so if you don't use a pillow, your leg actually falls down, right? So imagine if you're sleeping on your side and you don't use a pillow, then the knee will likely fall forward. So all night long, you are overstretching your hip and your low back. What does the body do when it feels that it's overstretched? It will trigger what we call a protective response. And the protective response is the body thinking, wait a minute, you're hurting me, you're overstretching me, let me protect myself by tightening up. So an overstretched muscle will eventually become tighter. That is a huge reason why people end up with back pain, hip pain, and knee pain. It's typically poor positioning when you're sleeping. Even, as far as your pillow, making sure that whatever position you're in, have your spouse look at you or maybe even take a selfie of you when you're sleeping on your side or on your back. Is your head in relation to your body in neutral position? So again, let's say you are sleeping on your side. If the pillow is too thin, what's going to happen is because of gravity, your head is going to tilt like that. Or the opposite, if you like using two pillows at the same time, then it becomes too thick that if you're sleeping on this side, your head is going to tilt the other way. So same concept, all night long, you're going to overstretch your muscles and eventually you are going to tighten it as it triggers that protective response. Avoid crossing your legs. I see so many people, and I'm guilty of that too. But when you are in pain and you cross your leg, what happens then is, I'm going to back up so you can see it, right? So when you cross your leg, now you're overstretching this part. This is essentially similar to sleeping on your side without a pillow. You are overstretching this. Not only are you overstretching this, but now your body has to turn. And so in the process, you have some muscles on one side that are tighter than the other. You're very likely going to overstretch this, which will lead to tightness. One of the most common question is, what do I use when I'm hurting? Is it ice or is it heat? I know it's very confusing, and I'm just briefly going to explain this to you. When you have pain, you don't know if there is an underlying inflammation. And if there is inflammation, that means that there is swelling and pain and redness. We're going to forget the redness because it's sort of irrelevant with a chronic problem. But if there is swelling and you're going to put heat, you're going to encourage the swelling. What does swelling do? It causes more pain. So for people who use heat, you will probably notice that when you apply the heat, it feels good, but then after a while, after that, it actually hurts again. So as far as from a scientific point of view, what does a cold does? It reduces swelling. You are better off doing cold packs. Heat, I typically recommend for people who are stiff, but they don't have a lot of pain. Be mindful of your everyday things. Again, it may sound repetitive, but I cannot overemphasize this. The idea of bending and twisting, there is never anything good with that movement. So how do you avoid the bending and twisting? Because we do that when we load groceries in the car. We do that when we do laundry. We do that when we are loading the dishwasher. What you can do is make a simple step, like a side step. So in other words, just take a side step and then bend. That way you are not twisting. It goes a long way if you are mindful of that. The other thing is for people who are lopsided, and I'm going to discuss that a little bit more in a little bit to answer a specific question. But when you are lopsided, and these people tend to think we need to strengthen. I am weak. I need to get stronger. I'm okay with strengthening, but please do stretching in addition to strengthening. Because if you are going to strengthen a lopsided body, you may feel stronger, but you are still lopsided. And a lopsided body will trigger the alarm system, which is your pain. And this is the reason why people who go to the gym in hopes of feeling better, that's the purpose of going to the gym, is that it will hopefully relieve their pain. They find that it doesn't. It is because of that reason. When you are loading like groceries, for example, to your car. Okay, so if this is the car and I am picking up, stuff from the grocery cart and I'm going to load it. So this is typically what we do. So we pick this up, we pick up something and then we load it, pick it up, unload it. So what happens when you do that is people don't realize they're actually pivoting. And pivoting does so much to misaligning your SI joint. So what do you do to make it happen? So it's just an extra step, which is you pick something up and you just do a side step and then you load. And then you pick something up and then you take a small side step. And that's how you avoid worsening your chronic pain. Something so simple, yes, it can be a bit annoying, but if it helps you minimize the pain, why not, right? That is so worth it. As far as exercises go, and these suggestions, I have heard this from multiple surgeons. So this is not even just my opinion, it is also the opinion of many, many doctors, which is if you want to be active, a really good way to do it that is not aggravating is to simply swim or walk. So instead of doing something so complex, just go for a walk or swim. Or if swimming is even painful, while you're in the pool, what I always recommend is you walk forward, you walk backward, and you walk sideways both directions. I'm not going to go into it, but that does so much to help you. And again, the idea is less is more. Always do what you can do. With chronic pain, no pain, no gain never applies. And I stand by that. I don't care if people say that's wrong. We've seen it here many, many times because that's what we do. And the gentler you are to your body, as long as you make an effort, that goes a long way. What makes chronic pain worse? Okay, some people don't realize that they're doing something that is creating their problem. The big one is sugar. I'm not going to go into the nutrition part. I'm sure you can Google it. But the role of the added sugar, especially, so I don't necessarily believe in all sugar, but the role of the added sugar is that it actually causes inflammation. Well, if the body is already in an inflammatory state, then you're just going to make it worse. The problem with that is it's so hard for people to give up sugar. My challenge to you is this: try it for 2 weeks. Okay, so try staying away from sugar for 2 weeks. After the 2 weeks, you can get back to normal. Whatever you want, you can do it. But what I want you to be aware of is how you feel after that 2 week period. Chances are you're going to notice a little change. And so when you go back to eating a lot of sweets, then you're going to notice that you're going backward. And that feeling that you had when you were feeling better, that is going to make you stay away from sugar moving forward. We always talk about red meat causing more inflammation. Processed food can cause inflammation. and trans fats can cause inflammation. I'm sure you can Google that, but I just thought it is worth discussing right now. How long will this last? And is there a solution to this, right? We always think of pain, when you have chronic pain, we always talk about pain management, right? So if you're talking about pain management, that means you're just managing your pain. There's no solution to it. We stand by this claim that you can actually solve chronic pain. It may not be completely, 100%, it will not go away. But imagine if you get 50 to 75% less pain consistently. What will that do to you? What would life be like if you do that? And so I know it's such a huge claim, but it depends on certain things, right? So when we're talking about chronic pain, these are the things that you should look for. I'm going to show them to you. And if you have these things that I'm about to describe, then that tells you that if you correct them, you can get 50 to 75% better. Okay, so here goes. Number one, is one shoulder slightly higher than the other? If you can't tell because it's so subtle, one of the ways to do it is to literally grab a pen and let the pen rest on top of the shoulders, one at a time. And you will notice that one will be a little bit more slanted and then the other one will be more horizontal. So that tells you that your rib cage is shifted. The other one is your pelvis rotated? So by that, if you march in place, and I'm going to step back and demonstrate this to you. So if you march in place, I'm going to back up so you can even see me better. So if you march in place and then you look down at your feet, does it seem to you that one foot is slightly, ever so slightly turned outward compared to the other? Or does it look like one foot is ever so slightly ahead of the other? Okay. What that really means is that your pelvis is actually facing one direction and not straight ahead. So for example, if my right foot is pointed out and then my left foot is straighter, that means that my pelvis is actually facing right. And of course, if I go point the opposite direction, that means my pelvis is facing left. So that is such a good way of checking that out. Another way of checking it out is to just simply cross your leg and you look at the height of your knee, okay? And when you compare the right versus the left, does it look like one is slightly higher than the other? If one knee is slightly lower, whichever direction that is, if the right leg is lower, that tells us that your pelvis is actually facing right as well. And so that's two. The other one is when you stand in front of the mirror, okay? You stand in front of the mirror, I want you to focus on the gap that is created between your hip and your arm as you are relaxing. And I want you to check, does it seem like one is closer to the arm? Just like this, right? Most people don't realize that they have that where they shifted over so that their forearm is practically resting on their hip. That means that your hip is shifted to the right, okay, in this case. Or if you have a neck or a shoulder problem, that means that your rib cage is shifted over to the left. So both are wrong, but that is just looking at it from a different perspective, depending on which area do you have pain. The other one is pelvic stability, okay, or pelvic instability in this case. So I'm going to demonstrate it to you. When you stand and you walk, right? For a split second, you are actually standing on one leg, right, in order to advance the other. So when you are standing on one leg, even briefly, if there is, so in my case, I am lifting my left knee. So you would think that I would fall over because my left leg is not supporting me. So the question is, why is it that I can stay standing when I'm only standing on one leg, like a flamingo? Okay. So the reason for that is we have muscles on the standing leg that pulls us to keep us steady or stable. So in other words, instead of, if I stand here, let me just check over here. Yeah. So if I stand here, instead of me falling over here, these muscles are going to pull me up in order to hold me steady. That's what it does. Well, if that becomes inefficient, it does one of two things. When you stand on this leg as you're standing, you are going to drop, okay? But majority of the time, the body is very smart and it will compensate. So when you stand on the right leg, it actually tilts, it throws you over to that side, and that prevents you from dropping. So those are the two possibilities when this part right here is not working. And I'm sure that some of you have pain right in this area. That's what that is. Okay. So how do you know that you have this issue? Well, you stand in front of the mirror, and I want you to take turns standing one versus the other. And what I want you to pay attention to is, how does the body behave as you stand on one leg? A lot of times with chronic pain, you stand on one leg and then you're pretty good, okay? And then you stand on the other leg and you tip. And so that is a classic example of somebody that has unstable hips or pelvis. And you're going to notice that if that is the case, if you are standing here and it's straight and stable, but here you tilt, essentially as you're walking, you will have a list to the left. And that is really the root cause. The root cause of that is the pelvic instability. No one really talks much about weight bearing unless somebody has a broken bone and they talk about non-weight bearing, full weight bearing, partial weight bearing. When we don't have those restrictions, no one ever pays attention to that. There are three ways you can check for weight bearing. One is when you stand, okay, I want you to take a moment. When you're standing, I want you to pay attention to how the body weight lands on your feet. I want you to figure out, does it seem like you are putting more weight on one leg than the other? That is a weight bearing asymmetry. The other way of assessing weight bearing is, if this is your foot, okay, as you're standing, does it seem like most of your weight is on the heel? Does it seem to be more on the ball of the foot, the outside, or the inside? And you compare the right and the left, how different are they? Because there's a very good chance when you have chronic pain that those are actually different, where one may be more on the corner, back corner, and the other one is more in the front. So that's one thing to check out. The other one is, while you are seated, okay, when you're seated, and you're, especially if you're sitting in a regular chair, so just imagine that I have the back support of a chair. So sit in like maybe a dining room chair and you just relax there. And I want you to pay attention to how your buttocks are touching the chair. Okay. Do you find that one buttock is actually touching the chair more than the other? That is so common with chronic pain. The other one is, if when you're focusing on how the shoulder blade touches your the back of the chair, does it seem like one side, maybe the right side is touching the chair more than the other. Okay. No one ever asks you that. No one ever asks you that question. But I want you to take a moment to observe that, because that tells you so much about positioning of your rib cage and your pelvis. I'm not going to go into it, but imagine if you feel that the right buttock is touching the chair more, and then the right shoulder is also touching the chair more. Well, what that essentially means is that your body is actually facing right. Because if my body is going to turn to the right, my right buttock and my right shoulder will be touching it. So that means that you're lopsided. Now, the occasions where you feel the right buttock touching the chair more, and then the left rib cage or left shoulder blade touching it, so it's like an opposite. There is such a thing. We see that here. It essentially means that your body is twisting. So in other words, the top part might be facing one way, and then the pelvis is facing the other. Okay. The other one is the other one is lying on your back. For those people who are so uncomfortable laying, sleeping, I want you to lay flat, and I want you to focus on how does one side touch the bed more than the other. You're going to find out that not both sides are in contact with the bed. And so that will highlight how lopsided you are. Okay. The other one is SI instability. Oh, no, SI dysfunction. So SI dysfunction, it's very easy to spot what this is. It just means that if you are sitting for 30 minutes or longer and you are going to get up and walk, you are going to notice that you feel like going like this, because everything is so stiff, and it takes you a moment to straighten. And then once you're finally straight, it's going to take you a few, the first few steps are going to, the first few steps are going to be a struggle, right? So you start limping, and then somehow it gets better. Okay. So for those people who have those symptoms, I want you to think, if you are blaming the herniated disc for that type of symptoms, what I want you to think is, why does it get better? Right? It shouldn't get better. If the nerve is pinched, it should not get better after the first few steps. That is an SI dysfunction. All right. And the other two is about muscles. So our muscles, there are specific muscles that overlap. I'm not going to go into it too much, but there are 8 different patterns where our muscles overlap. And based on how you look like, it tells us which muscles, which myofascial lines, we call it, which myofascial lines are problematic. There are 8 myofascial lines in the body. And if you correct that and address that, it will recalibrate those things that I just described to you. And so that is what allows you to get back to doing the things that you love doing. So I just want to demonstrate to you, imagine all those things that I described to you. I'm going to demonstrate it, and you can understand why you're in pain. Okay. So imagine that one shoulder is slightly higher than the other. Imagine that the pelvis is actually shifted, right? Like I showed you before. And then imagine that one foot is actually pointing out more than the other. Okay, so far we got 3, right? And I'm not even going to worry about the weight bearing, right? But just imagine that this is you, okay? And then maybe the ribs are also facing the right, okay? And then on top of that, when you check your pelvic instability or stability, you actually stand more here, but less tilt here. So this is you when you're walking and you're lopsided. You are turned, you are shifted, okay? And you're like, I don't understand why I can't walk. Can you see now how difficult it is to walk? And so when you have chronic pain, you're not really after pain relief. You are after the fact that you are struggling doing things like walking, sitting, and standing or sleeping. So when you take into account the fact that you are lopsided, of course, you can't do those things, those activities, right? Because your body is going to say, well, I'm not capable of it. So the question is, what if you take the time to recalibrate you? You're going to realize that there is a solution to this chronic pain. I'm not giving you false hopes. We see it here time and time again. Um, People that have those problems are the right fit for us, and we always see results. So I hope that that helps you. And if you have any questions, if you want to hop on a call because you're curious about what we do, please feel free to call us. We would gladly talk to you. It is not, we will never pressure you into anything. Our goal is to make you understand that there is hope. And by making you aware of what the problems are, then you can take the steps to correct it.